Thank you to the Debe Hindu Primary School for that beautiful rendition yet again of the Sanatan Dharma Mahasabha's theme song. So thank you to those young children and very talented musicians accompanying that theme song. Ladies and gentlemen, we have seen from the early part of this month, the month of April, where we had a series of tragic news. Sometimes, Shakespeare says the nature of bad news infects the teller. Well, sometimes when you have to speak about bad news, the nature of such news infects you as the teller. And that is why initially when I said that in introducing today's program, that we are going to exercise a certain amount of sensitivity, bearing in mind the tragic events which have unfolded. And now I want to specifically hone in on what I'm referring to. I'm of course referring to the series of deaths that have occurred starting from early April and even to today, that I saw headline news clippings which spoke to yet another death that occurred with these young infants, these baby infants. And it really is a tragic state of affairs. One of the greatest miracles of life, it is said, is the bringing of life into this world. And of course, that is where these young children come in. And you can imagine the joy that mothers would feel, parents as a whole, they would have in terms of investing emotionally. Some mothers put themselves on disciplined diets, the things that they would want ultimately for their child to foster as habits. Many years after they are born, they try to foster it during that pregnancy period, and they curb certain fetishes that they may have in terms of their diet and longings and desires, and some fathers go the extra mile to make sure that their wives and the mothers are somehow treated extra special during that period of time. And I say this, of course, in the best of lights, to just show that, look, we as a society, we understand the beauty of this miracle. We invest in this miracle. And so when it does not go in a manner which we expect it and we would like it to go, namely that the child is born healthy, free of disease, and that child can flourish into a beautiful individual, this is really something that I deem to be tragic. And in this case, we are talking about a series of numbers, possibly 18 based on the newspaper articles, based on the information in the public domain. And so just before I introduce our expert guest on today's program, to bring everyone up to speed, as we have done on other programs, rather than myself speaking to the articles themselves, I prefer to just do a video showing the various clippings so that we can recap what has been taking place in the public domain via the Fourth Estate, the media. So with the technical team's assistance, let's run that video clipping, please. So thank you to the technical team for that video, which I think has, as much as possible, accurately captured the news reporting on this particular sensitive matter. I want to, of course, introduce today's guest, someone who I have a tremendous amount of respect for, a highly qualified individual and an expert in his field. He graduated from the medical school in St. George's University, Grenada, after which he trained in obstetrics and gynecology in Brooklyn, New York. He received several accolades for maternal fetal medicine and high-risk obstetrics and minimally invasive surgery, laparoscopic robotics, being part of his training. In his final year of residency, he was the first OBGYN resident that was transferred to the COVID ICU during the first wave, for which he was granted a Heroes of COVID award from the hospital. After his residency, he returned to Trinidad, and he has been practicing obstetrics and gynecology with a focus on minimally invasive surgery and high-risk obstetrics at the esteemed Sanjeevani Women's Hospital, a private institution, but very esteemed and very accessible to members of the public. In May of 2023, this women's hospital successfully launched the first private NICU in the Caribbean. In September 2023, of course, this esteemed gentleman, expert in his own field, very highly regarded doctor, very young individual, is very, I have to say that I am somewhat amazed, but also in very much admiration that you can have such a young individual with all of these qualifications and having acquired what he did in his short span in terms of his education. He started in 2023, in September last year, lecturing in obstetrics and gynecology with UWI. Ladies and gentlemen, it is of course my pleasure and indeed an honor to welcome on our show today, Jaagaran, the Awakening, Dr. Vashisht Prasad. Doctor, thank you very much for joining us on the program
Thank
today.
you for having me, Sitaram, and namaste to all our viewers, and it's a pleasure to be on.
So, ladies and gentlemen, as I said, Dr. Prasad, his field is obstetrics and gynecology, and of course he is someone who we certainly felt could bring some light in terms of explaining those areas that we may not readily understand, because we are not all doctors, we are not all highly trained and have the depth of knowledge which Dr. Prasad would have. So, Doctor, first of all, I know that you are, of course, associated with the Sanjeevani Women's Hospital. I want to put it out there that his father, who is a very esteemed practitioner as well, would have delivered my two kids many years ago, my daughter in San Fernando and, of course, my son in St. Augustine. So he has traversed Trinidad. When I was living in South, he would have done the surgery. And in both instances, they were surgeries, right, that were performed in order to facilitate birth. And this is where I said earlier in the program that I think that knowing what people do, it is an act of ultimate union to be able to have a child, and what parents do is something that I speak of on a first-hand basis when it comes to having a child, and therefore when it does not go as we would like it to occur and take place, it leads to not just disappointment, it really leads to a situation where you have parents who are now broken, and it could lead to the relationship. Before we get into the effects on parents, Doctor, I would like you to tell us a little bit about what what is expected at the time of birth, because in this particular case, maybe we can start with definitions first, because what we are seeing is NICU, on that acronym is appearing, and maybe we can speak a little bit about what is neonatal, what is meant by that, what is an NICU, and then we can take it in stages.
Right.
So maybe I can leave the definitions for you to start the ball rolling.
Absolutely. So, yeah, pleasure to be here again. And before I start, I do want to say, our heart absolutely bleeds for the families and parents affected by this. And it's extremely tragic occurrence and occurs at a time when everything should be perfect, right? We expect to have a healthy baby and a healthy mommy at the end of this process. But we try to stick to the facts as much as possible, have a very evidence-based discussion about what's affecting the country right now. And the NICU or neonatal ICU is essentially an intensive care unit dedicated to the care of newborns with special issues. These may be newborns such as that were born premature, or newborns that are born small, or those that may have other chronic congenital conditions or conditions that they're born with. Some babies, for example, may be born with spinal defects or heart defects or other anatomical problems, and they need neonatal support as well. So that's what the NICU exists for. Yeah.
Okay, so this, do we take it for granted that we have NICUs in all of our hospitals in Trinidad, or is it that it is limited to certain hospitals?
Yeah, it's a great question. I think as parents, you don't really think about what happened, what can go wrong. I think if you look at social media now, there's a lot sort of out there about how natural this process is supposed to be and how perfect this process is supposed to be. But I think we do take it for granted that NICU support is available wherever we go. There are NICUs available at the major RHAs, so San Fernando General, Sangre Grande, Mount Hope Women's, and Port of Spain General. And in terms of the private sector, St. Giovanni Women's Hospital is the only private NICU that exists right now. And it's an important consideration because we aren't often always able to predict when things aren't going to go according to plan. So having that NICU support is really important.
Okay, so in this particular instance, ladies and gentlemen, and Dr. Prasad, for myself, what I certainly understand from the inception, when the first deaths were reported, we are told that septicemia is, I think, maybe the medical terminology or the label for this particular bacteria or condition caused as a result of bacteria. Can you just shed some light on what happens at the time of birth, the risks of children, having infections? Is it normal? If it is not normal, maybe you can tell us what do we look out for? And certainly in this instance, is it a fairly common bacteria? And we could develop the conversation like that based, as you said, on the facts that have been put forward in the public domain.
Absolutely. So, I mean, I think we know that babies are a little, they aren't born with as robust an immune system as an adult, and it takes time for that to develop. At the moment of birth, the child is exposed to bacteria, whether from mommy, from daddy, floating around in the air, from surfaces, and immediately, as soon as that child is born, they're going to become colonized, as we say, with different forms of bacteria. And that's a healthy process. That microbiome, we now know, protects us from certain diseases as well. But because babies have innately a reduced immune system or a suppressed immune system, they are more likely to develop infections from these bacteria that we may consider common to us and may not cause infection in an adult, but certainly can be more threatening to a child. Add to that, if a baby is born premature, those babies have an even less well-developed immune system. They may have less well-developed barriers such as skin and the gastrointestinal tract. And so, you have this normal colonization, but if there's any breach, this bacteria easily gets into the blood and gives rise to the condition septicemia.
In this particular case, what has been reported as the name of the bacteria in this particular instance?
I think it was E. coli was the one I think they called,
okay.
Right? Yep.
And this is one of those common bacteria that would be pervasive in the atmosphere.
Yeah, so E. coli, Escherichia coli, is one of those bacteria that exists in our gastrointestinal tract. And bacteria, even specific species, come in different flavors, right? There's really aggressive types and there's very mild types. And like I said, even mild types can be threatening to a newborn with a suppressed immune system.
Okay. So we have dealt with the bacteria, and I'm speaking, I'm sure you would understand, I'm trying to understand it myself as a layperson. What would be the type of infections expected in a hospital?
Right. I'm glad you bring that up because that's a good distinction to make. There are hospital-acquired infections and there are innate infections, right? A lot of time when a baby is received in the NICU, the most common reason for them coming to the NICU in the first place is usually infectious. But the common types of infections they may get exposed to either from the outside or in the hospital are meningitis, septicemia, which is an infection of the bloodstream, urine tract infections, and pneumonias. Those would be the most common neonatal infections we'd get.
Okay, so a particular baby contracting an infection, what would be the first port of call that you would expect medical personnel to undertake from the point of view of treating the baby, but also in terms of ensuring that it does not spread? Absolutely.
With babies, it gets a bit tricky, right? You and I, we can say we're not feeling well. We can say we have a fever. Babies tend not to say these things, obviously, right? But babies are, they give us certain signs, and they can present with signs of lethargy, where they're very quiet, or they're not feeding very well, or they're very irritable and fussy. You may find signs of dehydration where they look very flat and their skin is very, very loose because they're losing fluids. So these babies, when they're brought to the hospital, are should be assessed immediately. And once infection is suspected, protocol sort of dictates that the babies get moved into an isolation space and that the workup and the management happens in an isolated space so as to prevent that infection from spreading.
All right. So in this particular case, ladies and gentlemen, we have been reading that we have had babies who were infected, and the bacteria, it led unfortunately to mass numbers of deaths. As to what extent you would have had transmission from one to the other, and all of these things is a matter that I understand is now being probed. Doctor, we have heard naturally a population would want to get, sometimes we say they want to break the back of this. They want to get under this and really get to the meat of it, and to make sure that you don't have more deaths, or reoccurrence of such a situation occurring. I take it you would be fairly familiar with the fact that we have a PAHO investigative team that has, I think today they may have commenced investigation. Based on your knowledge, or are you aware of the expertise that are being drawn upon to comprise this PAHO team?
Yeah. So it seems to be a 3-person team, and they are coming in with international experience in microbiology and infectious disease and public health, which is appropriate for what we're trying to investigate. As we said earlier, the infection is the number one reason a baby gets admitted to the NICU in the first place. I mean, if you look at our stats, about 54% of babies admitted to the NICU in Trinidad are born because they're born premature. And we now know from robust clinical data that that premature labor is often precipitated by infection. So the baby usually, a lot of times, has already gotten to the NICU in an infected state. So it's a game of catch-up. So infection itself is not what's being probed here. What we have is a cluster of cases caused by the same bacteria. And what we need to figure out, or what the PAHO team needs to figure out, is whether there's a systemic issue that led to this spread. And whether this was preventable, and what steps we can put in place to prevent this from happening again.
In your expertise, and meaning the studies that you would have, of course, undergone, and your experience as well, are you aware of other situations where you had a cluster of these amounts of babies being infected?
Yeah, I mean, I trained in New York, and even in New York it happened from time to time. It's not very common. I think it's something that was very aggressively policed. in first world systems. But I don't. It's not something that should happen often. And I think the public outrage and feelings about this is justified, because we should treat this as an event that shouldn't happen at all. But we have to also understand that it can happen. We just have to make sure we are putting systems in place that prevent it from happening over and over again.
So, Doctor, I appreciate that. So, at least in your experience, you know of 2 instances where you would have had, I don't use the word outbreak, but several infections or cross-infection that would have led to significant numbers of babies dying. Just drawing on that particular instance, or those 2 instances that you referred to in New York, is there anything that you would have seen undertaken by the medical institution or any policing authority which we haven't seen take place now? And that is not to bring to bear. I'm not asking you to deem whether negligence has occurred. Just whether you would have seen any steps taken on those instances that we have not seen locally in terms of, somehow addressing how meticulous or diligent are we being about the situation?
Yeah, you're right. I mean, it is a different system with a different resources available, right? I think in a place like the US or in England, if this were to happen in a NICU, I think there's almost, if it was confirmed to be an outbreak and if an infectious spread within the NICU, steps are immediately put in place to separate those babies that may be at risk. In some cases where it's feasible, they may temporarily shut down the ICU. However, these places have other NICUs that they can use, and these babies can sometimes be transferred safely. But that is not something that's easy to do in Trinidad. We don't have those resources. We don't have another place for those babies to go to. So calls to shut down the NICU are, I think unrealistic at best. But certainly it's investigated very aggressively, and it's something that if it ever occurs, it needs to be nipped in the bud early and rectified early.
Based on I have a list. This is actually cited in the Newsday, Wednesday, April 24th, right? Very recent. And 16 baby deaths at Port of Spain General Hospital NICU. And they go through the names and stuff. And of course, again, the ladies and gentlemen, the dates of deaths, you start from April 6th, April 5th, April 4th, April 2nd, and this is how it goes. You have varying dates. We are seeing several dates here. The question I want to ask is, in terms of the time span during which these deaths have occurred, have we moved swift enough in terms of international standards to have an investigation commence? Or are we within a reasonable ambit of time that you would expect an investigation? Again, we make no pronouncement on negligence or anything like that. It's just a matter of what you would want to occur in terms of diligence and ensuring that we get to the bottom of this. Are we too late? Even if we are not too late, should we have acted sooner in having some team come here to undertake this investigation?
Yeah, I mean, it's a valid question. So, like I said, there's 2 different sort of beasts here. There is infection in a NICU setting, and there's an infection outbreak. So not every infection that happens in the NICU is due to an outbreak or due to a systemic failure. Most of the babies in the NICU are at risk, so it's something they're constantly fighting. When babies get intubated, when babies get lines put in, when babies, just by virtue of being born early, they're exposed to bacteria on a day-to-day basis. So infection in NICUs happens, and a lot of times, the teams are able to recognize it early and treat it. We know there's a cluster of 7 cases for sure with this one pathogen, but it is not clear yet whether the previous infections that led to deaths are linked to that outbreak.
Okay.
That said, that's what the investigation hopefully will reveal, and we all want answers as much as the next person.
Now, in one of the particular articles that I looked at, the parents were raising concerns about the treatment meted out to them. Now, I certainly appreciate that whatever we say and do, even on this program, we say and undertake on the outside of this program, and any individual in Trinidad and Tobago, that where if you have a situation of loss of trust and confidence in the medical institutions where people going to undertake, having delivering their baby, and the situation as it stands now is that you have very few private institutions, and that being so, not everybody would be in a position to go to the private institution. They would probably want to go to the public health system. So I say that as a preamble that we are trying to maintain trust and confidence. I'm not trying to be unduly critical or stating as a fact what has been reported as against the nurses and the healthcare professionals. But one of the parents, they are reported as saying that they were not being kept abreast of what was happening with their child. So they would have made complaints that the child somehow is not looking like a normal baby. The stomach, I think in one instance they said the stomach was unduly, in their estimation, unduly swollen. And another complaint was that when they spoke to the health personnel, they were told that don't worry, what is the issue? And in one case they said, well, there was a spinal tap that was conducted. I don't know what that is, but I hope you will share with us what it is. What would be the instances in which you would expect, using the spinal tap as an example, just one example, but what would be the instances in which you would expect medical personnel to keep the parents abreast of developments with the child?
Yeah. So in a perfect world, and what should happen is that parents should be abreast of all developments that happen with their child, especially major developments. We should not, as medical professionals, be dismissive of our parents, of their observations, of their complaints, of their questions. If someone's noticing something that's going on with the child and they ask the question, I don't think an adversarial atmosphere is needed. We should meet that query with confidence and talk them through what's happening. A spinal tap is it kind of alludes to the meningitis issue I mentioned earlier. That's where a needle is placed into the baby's spine, and a little bit of fluid is drawn out. And that fluid can be sent for testing to see if there's infection. Abdominal distension, belly swelling is another sign of infection that can often indicate issues with the gut, something called necrotizing enterocolitis. But these gut issues can present like that. So, and these are not minor things. These are things that, if a parent is concerned about if this procedure is being carried out on the child, I think they should be kept abreast. Someone should have an informed discussion with them and let them know what's happening. This is one of the systemic issues that the probe may look into, whether there's adequate staffing ratios that allow for these conversations to happen, or is it that the medical staff is stretched so thin that they can't address all of these concerns. Time will tell, and I look forward to the answers from this probe as well.
So, ladies and gentlemen, we'll take a short break at this time, and when we return, we will get into some more questions, and issues concerning these neonatal deaths, and so we can look at this matter in a manner which will be one that we can understand and probe. As I said initially, that we would want to probe in a manner that we are educated and ensuring that whatever steps are to be taken are taken, and moving forward that there is no reoccurrence of these cluster of infant deaths. So we will take that break at this time, technical team. And when we return, Dr. Prasad, we will have some more questions and we'll get some more responses from him that will help us to understand the situation.
My dear devotees, Sitaram, the Constitution of Trinidad and Tobago guarantees equality of treatment of all our citizens. This has not always been adhered to. We have often gone to court for these rights. Now we have radio and television to speak out and Mukdar to strike out.
Tune in every Friday afternoon at 4 p.m. drive time.
The Mahasabha will strike back. Sitaram.
Join me, Harold Nabri, every Saturday afternoon from 4 for the program Suhana Safar right here on your favorite station, TV Jaagaran. Suhana Safar, a program that goes behind the scenes, relives the pleasant memories and enjoy the modern music. I will explore the various aspects of the Indian film industry and celebrate with the players of this vast industry. You will hear some ghazals, bhajans, semi-classical music, and we'll also look at the history and development of the Indian music world. That's Suhana Safar every Saturday from 4 p.m. right here on your favorite station, TV Jagriti.
Sitaram, as we at Radio and TV Jagriti continue to emphasize the importance of creating healthy and happy families, it's our pleasure to present to you the program Hamare Sukhi Parivar, Our Happy Family, every Monday from 12:15 to 1 p.m. with our Dharmacharya of the Republic of Trinidad and Tobago, His Holiness Pundit Dr. Ramprasad Parasram. Pundit Dr. Ramprasad Parasram is an experienced psychiatrist and former chief medical officer who has had a long history in the line of social work. Join with him as he shares and discusses issues and ideas on improving and enhancing family life every Monday from 12:15 to 1 p.m. live on the Jagriti Network. Sitaram. Sitaram, I am Sharvani Sukhai, inviting you to be a part of my television sensation, Bollywood's Best on TNT's Best TV Jagriti. Tune in every Sunday morning from 10 to 11 as together we count down the top 10 biggest and best Bollywood videos of the week, check out the latest movie previews, and of course, what's trending with your favorite Bollywood celebrities. It's the only of its kind on national television, so don't miss it. Bollywood's Best every Sunday morning from 10 to 11, exclusive to TV Jagriti.
Thank you, ladies and gentlemen, for continuing to remain with us. Of course, that last clip that you would have seen put up on the screen by the technical team is reflective of this program and, of course, all who are involved in management of radio and TV Jagriti. And I know that Dr. Prasad himself would have started at the very inception of his speaking on this topic and this situation by extending condolences, and we would want to reflect that as well throughout the program, that, you know, this really, we would want to make it clear that our condolences continue to remain with those who have lost their loved young, newly born infants. I can only imagine, words fail me. I can only imagine what they would be going through with this situation. And this is something that maybe, Doctor, we can probably start off this continuation of the discussion with what I have only recently learned is probably the terminology in the medical world, the second victim effect. And maybe you can tell us a little bit about what is the second victim effect. And, you know, in a situation like this, what should obtain to ensure that we minimize this effect?
Yep, absolutely. So, you know, we not here to minimize the suffering of anyone, and we know the parents are going through a lot and the families are going through a lot at this time. I mean, absolutely undescribable, you know. But the second victim effect refers to those healthcare workers that are dealing with those patients and who lose patients and suffer secondary stress disorders, anxiety, and trauma from losing a patient. You know, it's something that's not often talked about when there's an adverse event or a patient is lost. We all grieve, but the healthcare worker often has to move on to the next patient, to the next task, and they don't get time to process that those feelings. And they would themselves be going through something. No one wants to lose a baby. So, our thoughts are also with the healthcare workers affected by this event as well.
That brings us to maybe an issue that we can discuss, but not necessarily, speak on, drawn from expertise. Namely that one would expect in these situations that you can have proper EAP, Employee Assistance Program counseling, or whatever should obtain to the relevant standards in the medical field for healthcare workers. And certainly the parents, something which I haven't read much about, but certainly these parents, I mean, how do you counsel these parents who have lost their infants?
Oh, and yeah, it's an uphill battle, and the old phrase "time heals all" is probably true here, but you're never fully healed from a loss like this. So it's something that can be very beneficial. It depends on, it's a personal preference. Some people heal by talking, some people don't heal that way. But counseling and grief counseling can definitely go a long way to helping a family deal with a loss like this and not moving on, but moving forward.
Well, certainly for my part, and this is not an opinion being expressed by Dr. Prasad, but for my part, I would hope that we have very meticulous advances being made towards treating with the parents in terms of whatever assistance they may need, counseling or otherwise, because this is not a situation that you set about to enjoy the bringing of life, but soon after to lose life, and therefore I hope and trust that the relevant authorities who may learn of this session, and if not through this session, but otherwise, good sense will prevail, that they understand that we need to have proper counseling and a proper outreach to all involved. Doctor, what can we expect, or what should we do to encourage persons having the faith and confidence, trust and confidence in the health sector, so that persons would still be prepared to go to the hospital? I'm thinking just hypothetically of a parent or parents who at this time are expecting, it's probably, I think it's 36 weeks, right, that we count. So if it is, you have exhausted your 36 weeks over the last weekend, and you are supposed to return to the clinic, or you should go back to the doctor, and something lays with them, but you are fearful of having the baby at this time. And that by itself will, of course, pose problems. I assume that is something that could occur in reality. How do we get these parents, particularly, to continue to have faith that, look, I am going to go to the hospital and I'm going to have my baby? What message, or how do you think we can deal with a situation like that?
Yeah, when there's an event like this, understandably, we're the whole public is in uproar about it. There's a lot being written in the media, a lot of the negatives are being published. But we also do have to recognize how necessary a NICU is. For example, they're probably the only unit that can't refuse an admission. If they get called about a baby, they have to take the baby, We also have to recognize a lot of the good that they do. So we're talking a lot about infection, and infection being one of the most common things that can happen to a baby in a NICU. But the NICU also deals with babies with other issues, those babies that need surgery, those babies that may not be feeding well or may have breathing issues. Those things are not necessarily mediated by infection, and those babies need that special care that only a NICU can provide. No, the NICUs have been doing that for a long time, but the good work often goes unrecognized, except by the parents of the child that benefited from it. So I think that's something maybe we could shed a bit more light on. But I think it's the only thing we can say to reassure the public is this has happened. It's being investigated. But at the time, now is not the time to close down the NICU, because the NICU still has a very vital role to play in the care of a newborn.
Okay, so ladies and gentlemen, encouragement is there, that this is what the NICUs have been established for. Two things that you touched on there, and maybe before we go on, we can speak a little bit about what, in your estimation, could possibly lead to this infectious spread in a NICU.
Yeah.
So we could do it hypothetical, or we could, at least probably speak a little bit about the instant situation, but what would lead to this kind of infection?
Sure. I mean, there's lots of ways. You know, there's lots of guidelines published by various infectious disease bodies around the world. You know, CDC, Infectious Disease College in America, the British Royal College, and all of this aimed at reducing the spread. And spread can happen in multiple ways. It can happen through a droplet. It can happen through touch. It can happen through feces and bodily fluids, urine. So in a NICU setting, there are certain guidelines that should be adhered to. There's a minimum distance between cots. There's a mandate that providers should wash in, wash out, wash in between, which means wash your hands before dealing with a baby, wash your hands after dealing with a baby, and wash in between. Even when you're dealing with the same baby, if you're moving from procedure to procedure, you wash in between. Use of personal protective equipment like gloves and gowns to help prevent infection from bacteria from getting onto you and then getting onto a baby can be helpful as well, especially when you're dealing with multiple infants. Another thing is the staffing ratios. How many nurses to babies should there be? How many doctors to babies should there be? If one person is dealing with 10 patients, then that person is going room to room, cot to cot, potentially spreading infection, versus if there's a one-to-one, which isn't always attainable, but if there's a one-to-one, that person is just dealing with one baby, so there's very limited chance for that organism to spread. The distance between the cots also speaks to the risk of the aerosolization of the droplets, so that if you're far apart, it stands to reason that the droplets can't get over to the other cot. So these are some of the ways that infection can spread, and these are some of the ways to mitigate that.
Okay, so at least we have an idea of how it is possible for this kind of infectious spread in a NICU. You also mentioned something else that I took mental note of, and maybe now may be an opportune time to mention. In a situation like this, and this is not necessarily drawing on your medical expertise now, but just generally, how does a population react to something like this? I think that at the end of the day, we would want to ensure that things, discussions, opinions are driven on facts.
Yep.
And our opinions are informed. What I did see very early, and I want to make it clear to people that this is something that we have always maintained on our programs, that if we are making certain statements, we want to know that we can back it up by facts. I saw that in the Senate earlier this week, and this is not to bring politics into it, but it was stated in the Senate itself, so it means that it is on the Parliament record, on the Hansard, that you had a certain probably reporter or media house, as the case may be, indicating that the infection was brought about by the transfer of one of the infants from private institution. And I do believe that they went so far as to identify that it was from the Sanjeevani medical institution, right? So I think that when I read it, the Sanjeevani Women's Hospital, this is what I know of because I am a follower on Facebook and things like that. Because you don't underestimate, as I said when we started this program, people invest a lot. Parents invest in knowing that they can bring life into this world. Part of the investment is seeing exactly what we are talking about, where you can deliver your baby, whether it's public or even private. In this case, I have been following the tremendous amount of work being done, and a forerunner, if I may say, right, the Sanjeevani Women's Hospital in terms of being, caring, the way women are treated, right, the bedside manners, the after treatment, post, I suppose there's a particular medical terminology for that, right? So even after the baby is born, I know the care continues for a while and things like that. So it was particularly alarming that you would have a statement being made as outrageous, and I use the word outrageous deliberately, as making it as though it was a statement of fact that one of the infants were transferred, and that is the source of the possible spread of the infection to other babies in the NICU. Now, that has turned out to be totally untrue. In fact, just to make it clear on the record, we have had no instances of a infant being transferred from the Sanjeevani Women's Hospital at any point in time leading to any one of these this period of infectious spread at the NICU. So how do we treat with a situation like that? I know that medical recourse will obviously be pursued, but any advice in terms of, or any statement in terms of how we should treat with information and how we discuss this topic in the public domain?
Yeah.
Whether you be a medical person, whether you be a politician, whether you be a TV reporter or hosting a program like this.
Yeah, and I mean, this was a classic example of very regrettable and poor journalism, really. And yeah, I'm happy to state it categorically here that Sanjeevani Women's Hospital has not transferred any babies to the Port of Spain General Hospital in over a year, and none of those babies have had infections or led to infections in the NICU. So that article linking us to these events is regrettable and completely untrue. And this is where I think there has to be a call for responsible journalism. The public outrage to these events is absolutely justified. No one wants to hear about infant demise and losing babies, and the public rightfully do want answers. And this is where journalists really need to exercise some degree of professionalism in investigating stories and leads and clues that they may be hearing through the grapevine, right? Because this was published and there's absolutely no oversight and no truth to it. The public reading these articles, it's not all of us have a medical background, but even without a medical background, we now find ourselves in a position where we have to take everything with a pinch of salt. Normally, if it's published in the news, it's news. It's credible. I think that's how I was brought up. I mean, that's how most people are brought up. But especially in today's day and age, I think everything, whether it be media, news outlets, social media, websites, we have to take everything with a little pinch of salt. And I think clarity has to reign supreme, and we need to be very clear in our minds what we're looking out for and not be reactionary to headlines that are often designed to incite emotional responses. Yeah.
Well, for my part, I think, Dr. Prasad, certainly when you have information put forward, as you have indicated, I too was brought up that when you saw something in the newspapers, in fact, homework, part of homework was, well, you need to keep reading the newspapers, right? But certainly from like Standard 3, right?
Yeah.
I don't recall teachers saying before Standard 3 that you needed to keep abreast of what is going on in the news and stuff, right?
Put them in scrapbooks and stuff,
yes,
right?
Yes. So yes, you had to do a fair amount of cutting, right? In those days, we didn't have the glue sticks, the dry glue sticks. So you had a lot of mess taking place that's my time. Doc, I don't know about yours.
Largely.
So yes, largely. So you had a lot of mess created in your copybook because you were using these liquid glue. And when you paste it and you stick the page afterwards, it stick a next page on the other side, and on the front side, the actual piece that you stuck, it became crimpled because how it was stuck. And a lot of problems. But anyway, that's the old days. Now you have dry glue stick. But I say this to mean that yes, I also was brought up from Standard 3, they started telling you have to read the newspapers because that is how you keep abreast of what is taking place in the country, in the Caribbean, in the region, and internationally. And what you read, you could basically hold on to that, and that is a statement of fact. What I saw, I think it is unfortunate. And why I say it is unfortunate, it is because making these kinds of statements, which has absolutely no truth, that a child, the cause of the spread of the infection had to originate from a private institution, is because for different reasons people choose a private institution, right? One, they may be able to afford it. Two, it's not so much affordability but accessibility as well. So it is accessible. Some people go to a private institution because the doctor who they have faith in belongs to the institution.
Absolutely.
Right? So in the case of Sanjeevani, your father being somebody who has been in that field for as long as I know myself, he has been there, has one of the best track records in deliveries and post birth treatment and things like that. What it does is that it not only diminishes the seriousness of what is taking place, but it tarnishes people's reputation who may very well be seeking the interest of these very people. You can seek the interest of these people, as I said when we started this program, by having a discussion. Others will seek the interest because they may be lawyers who are acting on behalf of the families.
Absolutely.
Healthcare professionals, as you say, the second victim effect. They themselves have rights as well, and you would want to know that they feel comfortable in treating with future cases, right? Future births and infants coming in there, and in the said NICU as well, right?
Yeah.
So I wanted to make that clear, and I'm glad that we were able to clear it up, because I know that there are a lot of people who, as I said, for different reasons, and to me, most of all, you identify with certain doctors. Having a child, in my case, my daughter came first. When I remember going to the hospital, it started at 2 a.m. in the morning, right, with the contractions. I think that's what they call it, right, the contractions. I was just too busy sleeping, but my wife woke me up at 2 a.m. and said, it is time. So this is me going in the shower and whatever and stuff at that hour in the morning. And in those days, I lived in San Fernando, so it was just about 3 minutes drive from where I lived to the private institution. When we got there, the nurses were very, friendly, and they said, okay, they went through the motions, called the doctor. Doctor says whatever, and some of these doctors, maybe yourself included, do give out a personal pager number or maybe a work phone number that you can contact on any cases of emergency. And I'm sure all of this was done with my wife doing what she had to do. We had the baby bag packed. And so we just took up that and we were on the way. Getting there, it turned out that we had to wait 3 days to be able, because of certain complications. Thankfully, you have a very excellent doctor on board who was able to manage what was taking place, so that you didn't have any negative effects, right? Don't mind you were not able to have a normal, natural delivery. It had to be a C-section, so it required some surgery. And ladies invest emotionally and otherwise. What I have observed personally that women do in giving birth, I don't want to be a woman because it requires a lot of strength. And when I saw the size of needle that was, utilized to do the anesthesia, I think that's the proper term, but the anesthetist, injecting that so that you could have the numbing of the body and whatever else, so that you could have the C-section. That's not something I would put myself through.
Of course,
Right? So I am just saying that in the context of, I could imagine that the females, the mothers, have their own attachment to the doctors who care for them. And this is where I think, if you tarnish the reputation of these individuals, it could lead to a loss of confidence where people lose faith, and it could have it may not happen this month or 2024, but it could cause effects, over a period of time where you see women are taking a different approach to when they have to go to the hospital or even to have babies, in settings like these.
I think it's a really important point to bring up, that bond you develop with your provider over the 9 to 10 months, the 40 weeks of pregnancy. And as I'm sure not a lot of our viewers know, the Sanjeevani plant is the herb that brings life into the world. That's how it roughly translates into English. And Sanjeevani Hospital was set up to to set a new standard in women's healthcare, to adhere to the highest international standards for women and women's healthcare, childbirth and aftercare and pediatric care. So it was troubling, and the reason we even had a NICU in the first place is that we aren't always able to predict when things may not go according to plan, and sometimes a baby is born and then there's issues at birth or within a few hours after delivery, and we know what a rough process that can be to transfer a baby from private institutions to a public hospital, knowing that the public hospital might be overstretched and their NICUs may be overwhelmed, but we're sending a sick baby, so you have no choice, you got to take it, right? And now we're separated that baby from its mother, and that's very traumatic for the mom and the parents as well. It's a big cause of postpartum depression. Even when we pick it up early, and we know that, okay, mom, you're probably going to have to deliver in a place that has a neonatal ICU. Patients are very apprehensive about leaving their doctor that they've built a bond with, sometimes as well. And potentially going to a place where they may not get that level of care that they expect. They may receive it, but they're nervous about it, understandably. So that was the entire reason NICU was developed at Sanjeevani. And I think that's a point that we alluded to earlier was what can parents do? How do we reassure parents? And I think if you're planning to deliver privately or even publicly, it's a good opportunity to talk to your doctors and ask what's the contingency plan for if things don't go according to plan. What happens if my baby needs a NICU? And consider what your options are before we have to get to that situation. We love the NICU. We hope to never use them. We hope to have a full-term baby that never needs any care. But the reality of the situation is it happens.
Yes.
Yeah.
And NICUs are also there for premature born babies.
Yeah.
So it's you have, and these things do happen.
Yeah. Yeah.
So for whatever reasons. Dr. Prasad and ladies and gentlemen, if we take another break at this time, and then we will continue with the discussion towards concluding the program. But at this time, we'll take a short break and we return in a few moments.
Yeah.
Sitaram, I am Sharvani Sukhai, inviting you to be a part of my television sensation, Bollywood's Best on TNT's Best TV Jagrati. Tune in every Sunday morning from 10 to 11 as together we count down the top 10 biggest and best Bollywood videos of the week, check out the latest movie previews, and of course, what's trending with your favorite Bollywood celebrities. It's the only of its kind on national television, so don't miss it. Bollywood's Best every Sunday morning from 10 to 11, exclusive to TV Jagrati.
My dear devotees, Sitaram, the Constitution of Trinidad and Tobago guarantees equality of treatment of all our citizens. This has not always been adhered to. We have often gone to court for these rights. Now we have radio and television to speak out and Mukdar to strike out.
Tune in every Friday afternoon at 4 p.m. drive time. The Mahasabha will strike back. Sitaram.
Sitaram, you are invited to join His Holiness, the Dharmacharya of the Republic of Trinidad and Tobago, Pundit Dr. Ramprasad Parasram, every Wednesday from 12:30 to 1 p.m. on radio and TV Jagrati for the program Understanding Dharma, helping us lift ourselves from the mundane to the sublime, from turmoil to peace, from bondage to salvation. Understanding Dharma with our Dharmacharya, His Holiness Pundit Dr. Ramprasad Parasram, every Wednesday from 12:30 to 1 p.m. on radio and TV Jagrati. Sitaram.
What you need to know, it's your business. As the world's economy evolves, what you need to know, it's your business. Keeping an eye on business and informing you on its happenings, it's our business. Eye on Business on radio and TV Jagrati, weekdays at 9 a.m.
Ladies, thank you very much for staying with us, ladies and gentlemen. And Dr. Prasad, of course, continues to give of his time to be with us to explain some of the deeper concepts associated with childbirth and NICUs, right? Neonatal ICUs. On this program, meaning Jaagaran, and also other programs, Mahasabha Strikes Back, and even other programs that we have hosted here, from time to time, I know we often seek recourse in Dr. Bratt's articles because his weekly articles are very informative on not only medical things but issues, but other matters as well. And so I urge people, there's an article that I saw 23rd of April 2024, NICUs, and basically I saw certain things there, said there which I think persons may want to inform themselves. And he said in part of his article that we have known, meaning we as a country in Trinidad and Tobago, we have known since 2003 when Jamaican Dr. Barbara Johnson, PAHO Temporary Advisor of Pediatrics, and Trinidadian Miss Yvette Holder, Consultant Biostatistician and Epidemiologist, presented a PAHO-sponsored review of neonatal units at the 4 neonatal units at Port of Spain General Hospital, San Fernando General Hospital, Mount Hope Women's Hospital, and the Sangre Grande County Hospital. And that report was titled Analysis of Perinatal and Neonatal Mortality. He spoke about the findings that their major finding was the unsatisfactory design of the neonatal units at Port of Spain and San Fernando, with chronic overcrowding at Port of Spain, San Fernando, and Mount Hope. Recommendations were made to expedite plans and to extend and modify the nursery at San Fernando General Hospital, extend the Port of Spain General Hospital nursery into unused area, and erect the new nursery at Port of Spain as proposed. Dr. Bratt says that was 22 years ago. They also found that there were regular outbreaks of infections at the 3 larger institutions due to a shortage of trained ICU nursing staff with unsatisfactory nurse-to-patient ratios and an absence of trained ICU dedicated medical staff, and recommended, among other things, that infection control units be strengthened. That some of this has taken place is undoubtedly true, but the babies are still taken care of in an old-time prem unit areas. I presume that is premature units, premature babies. And this is what I wanted to say before we continue with the discussion. Dr. Bratt says in his article, despite optimal treatment, neonatal sepsis, meaning infection, right, Doc, continues to have high mortality rates and poor outcomes. While the mortality rates have declined substantially, further progress is difficult unless the recommendations of the 2003 PAHO team are followed. But that depends on politicians and administrators. And this is what he says, and it ain't going to happen soon. So, of course, he presents an opinion. Yeah. And I respect Dr. Bratt's article, which I wanted to just throw out there, ladies and gentlemen, because, Dr. Prasad, who is in studio, who is on set with us, is speaking about it from a point of view of a holistic overview and assessment, knowing that there is an investigation that has started and will be ongoing. So he's presented it in a manner which we can understand what we should be looking out for, and which I appreciate. Dr. Bratt has not said anything which is damning of what is taking place now. He has certainly presented something which took place in 2003 and saying that this is the direction in which we start to be looking. So I want to commend Dr. Bratt. I commend his article to you, ladies and gentlemen. And Doctor, for our purposes, we'll continue the discussion. Based on what I have just read, Dr. Bratt is making certain recommendations based on a PAHO report of 2003. And if we can, how do we deal or would we be able to predict when a child is likely to need attention in a NICU? Is that something that is possible?
Yeah. I mean, Dr. Bratt's a great guy. He's been doing medicine longer than I've been alive, I presume. And a lot of his calls are very much justified. I think, I hope, we are looking forward to the findings of the report. But I do hope that action is taken after the report comes out. And I think I hope, Trinidad is a short memory kind of nation. I hope this is not one of those things that blows over and nothing changes. I hope once the report comes out, we look forward to those findings, that action is taken, because he's right. I'm not affiliated with the RHG and Port of Spain General Hospital, so I can't say specifically what's happening on a day-to-day basis or on the ground level, but I think, they are practicing in often older spaces that weren't necessarily designed for the volume and traffic that they see now, and that hasn't been updated in many, many years. As to when a patient may need to be in a NICU and how we can predict that, that's really what antenatal care and obstetric care focuses on. We know the most common cause for that is prematurity. So a lot of times your obstetricians are educating patients on symptoms of preterm labor. We're looking very closely at moms who have risk factors for preterm labor, such as poor diet, poor low weight or being overweight, poor health status in general. There's a lot more moms who are older at conception, and those moms may have chronic diseases such as diabetes and hypertension. All of these things makes you a little bit more high risk for needing a NICU. There are interventions that have been put in place now, and that we have very strong, robust data for. Things like checking of the cervical length, checking of doing serial growth scans to see if the babies are growing well. Close monitoring of the pregnancies in general, especially when high-risk features are identified. And once they are, I think these patients are sort of moved into high-risk brackets, and they are the ones that become, more or less high alert for needing admission to a NICU. In our setting, what we kind of do is we try to have a multidisciplinary team discussion about them before they deliver, so that it's not a surprise to anyone. When the baby is born, everyone's ready for it. That may not always be possible. Sometimes in obstetrics, things move fast, and someone who had absolutely zero risk factors may go into labor at 32 weeks, and then we have to figure it out, Right. But certainly, yeah, when you have these high risk factors, that will predispose you to being in a NICU. Because we've seen the NICU admission numbers go up over time, but the annual birth rate is either holding steady or falling slightly. So that points to an increasing need for the NICU and an increasing sort of chronic disease profile in the mothers, at least at a population level.
So I think it is a rhetorical suggestion or question. The best that we can expect and would want of the relevant authorities is a full deep probing investigation and analysis, and of course implementation. Because that kind of transparency, we need transparency. I think our population, and this is not for you to necessarily respond to Dr. Prasad, but I want to say, ladies and gentlemen, that myself, being involved, wearing different hats and being out there is a natural hesitance on my part to take for granted that when you have a report, that the report will be made public, because I don't understand why sometimes when you spend a lot of taxpayers' dollars on getting investigations by experts and you have experts from different countries, in this case it is PAHO because it's a medical situation, that report will be presented in a timely manner, because we have had a situation where divers died in this country. Yes, litigation is still ongoing, but I'm just stating a fact. These divers died. There was a commission of inquiry, but it took an unusually long time, having regard to the facts of that case, for the report to be brought and laid in the parliament and therefore become public and things like that. And I find that in these sort of scenarios, it should go without saying that from the minute the report is presented to the relevant authorities, that report should be immediately circulated. Yeah. So maybe you may need a day in advance, because you yourself want to make sure that the report, it contains 45 pages. You need to get it to the cabinet, because the cabinet needs to deliberate or whatever it is, to say, well, okay, we need to assess this in a particular way. And therefore you want to take some steps to know what you're going to tell the population, because at the end of the day you want the trust and confidence to continue in the medical institutions. But trust and confidence demands full transparency and accountability. So I say it in the context of what the population has experienced. I think I am drawn sufficiently enough from the population to echo that they seem to have a hesitance in taking things for granted, that we will get the answers that we deserve. Yeah. But the best thing that can take place here, I think, would be to have full transparency and accountability. It brings me to possibly my last question to you, Dr. Prasad. How encouraging is this entire sordid affair, right? I don't diminish anything that has happened in any way, and the plight and the feelings of the families who are immediately affected by the loss of these young children. But how encouraging is this entire situation for yourself? And maybe you hypothesize a little bit, professionals practicing in this field.
Yeah, I mean, encouraging is a strong word. I echo your thoughts about the fact that this report needs to be